Hi everyone, welcome back to the Navigant Credit Union Broadcast Center. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in for the 4 o'clock news and politics show. We have a full one for you. Just talk national healthcare issues with GOP candidate for U.S. Senate Bob Flanders. We're going to get a lot local here with an expert in the field, former president of the Hospital Association of Rhode Island. Ed Quinlan, thank you for taking the time to come in today. A lot going on here in the healthcare arena these days.
The pace doesn't slow down.
So you were at the helm of Harry for a number of years, and you've seen the hospital landscape change dramatically, both during your tenure and since then. So give folks a little bit, before we go into what's happening today, a little bit of the historical perspective of how we got to where we are now in 2018.
I retired just 4 years ago, and we already have one fewer hospital. So that points out how quickly things change. I don't know if most Rhode Islanders are aware that only 25 years ago there were no systems in our state. We now have the lifespan system. We now have the Care New England system. We have the charter care system. Even Eleanor Slater Hospital, a state institution, is a 2-hospital system. So the pace of change has been rapid. We now have 4 hospitals in the state of Rhode Island that are owned or operated by out-of-state companies. I don't know that a lot of people know that the charter care hospitals are owned by a California company, Landmark by a California company. Westerly Hospital is owned by Yale. So that's 4 out of 11 that now have out-of-state owners.
So you talk about, over the past 25 years, not having systems, going to healthcare systems. We'll talk a little bit about Partners in Care New England shortly. But is this the trend that's going to continue? Are we going to see this further consolidation of the hospital system in Rhode Island and nationally?
Well, we only have one independent hospital left in Rhode Island, and that's South County Hospital. Rhode Island does not look different than the other 49 states in terms of organization, consolidation, partnerships. That will continue. There's a variety of reasons, but with the pending Partners acquisition, if this is to be approved, we would see yet more change coming here, yet another out-of-state organization coming into Rhode Island.
Let's just talk about hospitals. We've had the former director of health here, Michael Fine, in that just says, we've got too many beds. We've got too much hospital, the hospital industrial complex. What do you have to say to that? Do we have too much? Or are we, again, having concerns about what might be looking like moving forward?
Well, that's a discussion that's been held for many, many years. I unfortunately participated more often than I would have liked. But the key element here is not how many hospitals, but how many beds. Now, we have about 3,000 plus hospital beds licensed in Rhode Island. Only about 2,000 of them are operational. So we don't have 11 hospitals with empty floors and beds. The utilization rate of our hospitals has leveled off in recent years, as it has all across the country, and that trend is likely to continue. But the true metric is not how many hospitals we have, but the number of services, the range of services, and the location of the services. Those are the metrics that should really be looked at.
And so when Dr. Fine says that we have too many beds, is that, I mean, what's your response to that?
Well, again, if you look at the utilization of the beds that are presently operational, and the term for it is staff beds.
Okay.
So we don't have people standing by.
Staff capacity with no beds.
Empty beds. You can't even find those beds anymore. They're used for other purposes. You always want to be staffed appropriately to take care of the patients that you serve. However, the pace of change is such that hospitals and really all healthcare providers have to really stay close to those changes in order to best serve their communities.
So let's talk a little bit about Partners eyeing Care New England. We know that they just requested an expedited review if they're granted to put forth their Hospital Conversion Act application. You know, we're here in the shadow of the Superman building. We saw what happened when Bank of America came in for Fleet. Didn't really work out so well for the Bank of America building there. With an out-of-state entity coming in, I mean, are there concerns about numbers of jobs and consolidation not benefiting Rhode Island, but in fact Massachusetts?
Well, we have in state law the Hospital Conversion Act, which was created about 10 years ago to protect those concerns that you are raising. And that is, how do you best protect the ability of hospitals to care for their communities? And through the legislation, the Department of Health has the principal role, but the Attorney General also has a role in reviewing that application. If the Partners Care New England application is filed and is then considered by the regulators, that will be an exhaustive review. The public can participate in that review. There are a few people in healthcare who will not have an opinion on it, and they'll make those views known. The director has the ability to approve or reject. The director also has the ability to qualify an approval. So there
Okay.
could be conditions attached to it that an applicant may choose not to accept. So it's a complex, large transaction that will likely be considered, and the Department of Health and the Attorney General will have their work cut out, and it will not be a short process.
Well, again, they want the expedited review, so that's, I believe, 90 days versus 120. Is you talk about an exhaustive review. Is that enough time?
Well, you've got the expedited review statutory calendar. However, the key element of that is, when does the Department of Health deem the application complete? So the Department of Health may have questions that could consume months. Until they actually deem the application accepted, the review doesn't start, the clock doesn't start.
The clock's not on the field. So you talk about the Hospital Conversion Act being in place to look at how, again, the one hospital system is potentially transferred to another. But can the state really ensure that the jobs and the systems are protected through that mechanism?
Under the Hospital Conversion Act, which is broadly written, that therefore, one could say the director, under her authority, would have the ability to attach conditions. There has never been a Hospital Conversion Act acted upon in which that level of detail has been included.
So do you think, what should folks really be looking at as they see this move through the process? Because again, the folks really only get the news when it comes out from the Department of Health. What should the average Rhode Islander be looking for as this process moves forward?
They should pay attention to the reporting, the media coverage of the application itself. But there is no regulator who has the ability to anticipate every scenario that others might be concerned about. Some might talk about, well, there might be an exit of patients to Boston. We already have the Brigham Partners Hospital, who has been active with a service at Kent Hospital now for many, many years. We're in a regional marketplace. So the likelihood of that happening is not supported by history.
So, as you said, not supported by history, so the likelihood of that being in there, again, the potential, because a lot of the talk right now is for more Rhode Islanders having to go up to Boston for their health care, which clearly a number of Rhode Islanders have concerns about. Are there any avenues for protections? And as you said, hasn't been any stipulations in the past. Will Rhode Islanders be going to Boston more for their health care if the Partners Care New England acquisition goes through? I
would suggest that history be considered. Right now, and this comes as a surprise to many Rhode Islanders, Rhode Island on the inpatient side is actually a net importer. More patients from neighboring states come to Rhode Island for care than leave Rhode Island. And
where are they coming from?
they're coming from across the borders. And so I think that speaks well of healthcare in Rhode Island. And I think people typically want their care as close to home as possible. And
that is true.
I don't know that most cases that were to leave Rhode Island and go to Boston, go to New Haven, would typically be a situation in which the volume of those cases in Rhode Island is very, very small. So that expertise might not be here. It's a small, small number. Changes in how patients will seek their health care in Rhode Island, history does not suggest that has happened.
So let's take, again, a broader look, taking a step back here. We're keeping an eye on Partners and Care New England. And as you mentioned, 25 years ago, there were no healthcare systems in place. We talk about Charter Care, Landmark Hospital, all being owned by out-of-state interests. What is, again, what does this mean for healthcare in Rhode Island to have so much of the control and power and purse strings being dictated by out-of-state interests?
Patients typically won't be able to see it, touch it. Patients will evaluate a hospital by the quality of care that they have received in the past, by their relationship with their primary care physician and their physicians that they might have a chance to use. So they are not going to be looking at the ownership issue as much as they are the hospital that they've had experience with in the past.
So both hospital issues, also pocketbook issues. I know the health insurance commissioner warned of potential health insurance premium increases if the Partners Care New England acquisition deal moves forward as well. Do those play into it? Will folks, there's the hospital side and the care side, but there's also the pocketbook side.
I think until the application is filed, it is very, 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 very difficult to make that that assessment right now. Most of those questions have been raised publicly for the past year, and doing so, you probably have seen both Care New England and Partners try to anticipate some of the questions and concerns people might have and address them going forward.
So we've talked about what the regulators will look at with the Hospital Conversion Act application. Are health insurance premium costs part of this review process?
No, because that's not predicted. You have to look at how hospitals are reimbursed. The majority of hospitals in Rhode Island, significant majority of hospitals, their prime payer source is government. It's through the Medicare or Medicaid program. Providence hospitals are even higher, maybe 60–70%. So those rates are set. We have a cap in Rhode Island established by the Insurance Commissioner 10 years ago on the rate of increase every year. So there are very, very few opportunities for hospitals in Rhode Island to really, really do much on the pricing side. And it's probably contributes significantly to 2/3 to 3/4 of the hospitals in Rhode Island every year lose money.
And is that trend ever going to change? I mean, tell viewers about the profitability of hospitals and where that trend is going both nationally and locally.
The margin being that figure that represents your revenue over your expenses. And in Rhode Island, we typically, in recent years, have averaged a margin of less than 1%. The national average is approaching 4%. So Rhode Island has struggled in recent years.
And why is Rhode Island behind the 8 ball?
I think you're going to always see the, shall we say, discussion between payers and providers as to what the appropriate level of care is. The hospitals will say if we're giving $1 of care, we can't care properly for patients if we're getting 80 cents, 70 cents on the dollar. So the insurers will say we have an obligation to ratepayers to protect their premium levels. So that's a discussion that's gone on for 75 years and probably will continue to go on.
And
Medicare,
counting.
Medicaid, Medicare rates, those are set in Washington. Medicaid is set in the state Rhode Island. States that are under budget pressures are going to see Medicaid as a big expense. Those reductions have followed.
So while I have you in here, last question, Ed, before I let you leave, just had Bob Flanders here and telling folks why he is opposed to Senator Whitehouse's support of Medicare for all. Of course, the incumbent senator is supportive of it. What's your view from the national level?
Well, Medicare for all, that has been discussed a number of years. It's almost a single payer model, and no state in the country has gone that route yet. Obviously, commercial insurers would not be pleased with single payer for all. I think it's a debate that will continue. I don't see it happening anytime soon, but if the Senator Senator Whitehouse has a view that this is best for the country, he will continue to pursue it, and I'm sure his opponent will likewise weigh in on why he does not see this being good for the country.
Well,
It's August and November's around the corner.
November is directly around the corner. But again, we're keeping an eye on Partners and Care New England here and more in the healthcare industry, and wanted to take the time to have former Hospital Association of Rhode Island President Ed Quinlan in to talk about healthcare issues. Ed, thank you so much.
Good to see you.
Don't go anywhere, and don't go anywhere. We'll be right back with our next guest here in the Navigant Credit Union Broadcast Center.